Welcome to our comprehensive guide on the respiratory system. In this video, we'll explore the structure and function of the respiratory system, how it supports life, and the essential therapies used in respiratory care. Whether you're a student, a healthcare professional, or simply curious about how your body breathes, this journey will help you understand the vital processes that keep us alive. We'll start with the basics, move through detailed anatomy, and finish with practical techniques for maintaining and improving respiratory health. Let's take a deep breath and begin our exploration together. The thorax, or chest wall, plays a crucial role in protecting our vital organs and supporting the mechanics of breathing. It consists of the ribs, sternum, and thoracic vertebrae, forming a sturdy yet flexible cage. This structure not only shields the heart and lungs, but also provides attachment points for muscles involved in ventilation. The chest wall's unique design allows it to expand and contract, enabling efficient airflow during each breath. Understanding the thorax's anatomy helps us appreciate how our bodies maintain a delicate balance between protection and movement, ensuring that every breath is both safe and effective. Breathing is powered by a group of muscles working in harmony. The diaphragm is the primary muscle of inspiration, contracting and flattening to draw air into the lungs. Alongside it, the scalenes and parasternal intercostals assist during quiet breathing. When we need to breathe more deeply, accessory muscles like the sternocleidomastoid, upper trapezius, and pectoralis major step in. During forceful expiration, the abdominal muscles and internal intercostals help push air out. This coordinated muscle activity ensures that our lungs can efficiently exchange gases, adapting to our body's needs whether at rest or during exercise. Breathing is more than just inhaling and exhaling, it's a complex mechanical process. As we inhale, the rib cage moves upward and outward, the diaphragm contracts downward, and the thoracic cavity expands. This creates negative pressure, drawing air into the lungs. During exhalation, the process reverses, muscles relax, the chest cavity shrinks, and air is pushed out. The rib movements can be described as pump handle and bucket handle actions, increasing the chest dimensions in multiple directions. These mechanics ensure that our lungs fill and empty efficiently, supporting optimal oxygen and carbon dioxide exchange. Airflow in the lungs depends on pressure differences and the compliance, or stretchiness, of lung tissue. When the chest expands, pressure inside the lungs drops below atmospheric pressure, drawing air in. Compliance refers to how easily the lungs and chest wall expand. Healthy lungs are highly compliant, but diseases like fibrosis can make them stiff, while emphysema can make them too floppy. Airway resistance, affected by airway diameter and mucus, also plays a role. Understanding these concepts helps explain why breathing can become difficult in various lung conditions and why therapies target both airflow and tissue flexibility. The respiratory system is divided into upper and lower tracts. The upper tract includes the nasal cavity, pharynx, and larynx, which filter, humidify, and warm incoming air. The lower tract starts with the trachea, branching into bronchi and bronchioles, and ends in the alveoli, where gas exchange occurs. Each branching airway becomes smaller, increasing the surface area for efficient oxygen and carbon dioxide transfer. The mucosal lining and cilia help trap and remove particles, keeping the lungs clean. This intricate network ensures that every breath delivers fresh air deep into the lungs. Our lungs are divided into lobes and segments, each covered by a thin membrane called the pleura. The right lung has 3 lobes, while the left has 2 and a unique structure called the lingula. The visceral pleura covers the lungs, and the parietal pleura lines the chest wall, with a small amount of fluid between them to reduce friction. This arrangement allows the lungs to glide smoothly during breathing. The negative pressure in the pleural space keeps the lungs inflated, and any disruption can lead to lung collapse, highlighting the importance of pleural health. Lung function is measured using various volumes and capacities. Tidal volume is the air exchange during normal breathing, while inspiratory and expiratory reserve volumes measure extra air inhaled or exhaled. Residual volume is the air left after maximum exhalation. Combining these gives us capacities like vital capacity and total lung capacity. These measurements help diagnose and monitor lung diseases, as conditions like COPD or restrictive disorders alter these values. Understanding lung volumes is essential for assessing respiratory health and tailoring effective therapy plans. A thorough physical examination is vital for diagnosing respiratory issues. Clinicians observe chest shape, posture, and breathing patterns, looking for signs like barrel chest or use of accessory muscles. Palpation helps detect tenderness or abnormal vibrations, while percussion assesses lung density. Auscultation with a stethoscope reveals breath sounds, identifying normal airflow or abnormal sounds like crackles and wheezes. These techniques, combined with patient history and additional tests, provide a comprehensive picture of lung health and guide effective treatment strategies. Breathing exercises are fundamental in respiratory therapy. Techniques like diaphragmatic breathing, segmental breathing, and pursed lip breathing help improve ventilation, reduce breathlessness, and enhance cough effectiveness. These exercises can be tailored to each patient's needs, whether recovering from surgery, managing chronic lung disease, or increasing endurance. Proper instruction, relaxation, and practice are key to success. Combining breathing exercises with other therapies, such as airway clearance and aerobic conditioning, leads to better outcomes and improved quality of life. Effective airway clearance is essential for patients with respiratory disorders. Techniques like controlled coughing, manual assisted cough, and postural drainage help remove mucus and prevent infections. Therapists may use percussion, vibration, and specific body positions to mobilize secretions. Teaching patients how to cough effectively and use these techniques at home empowers them to manage their condition and reduce hospital visits. Regular airway clearance improves breathing, reduces complications, and supports overall respiratory health. Chronic obstructive and restrictive pulmonary diseases require lifelong management. COPD, including chronic bronchitis and emphysema, leads to airflow obstruction and breathing difficulties. Restrictive disorders limit lung expansion, often due to fibrosis, surgery, or neuromuscular issues. Management includes medication, breathing exercises, airway clearance, and graded exercise programs. Early intervention, patient education, and a multidisciplinary approach are key to improving function and quality of life. By understanding and applying these principles, patients and caregivers can better navigate the challenges of respiratory disease. In summary, the respiratory system is a marvel of structure and function, supporting life with every breath. Understanding its anatomy, mechanics, and the therapies available empowers us to maintain and restore respiratory health. From the chest wall to the smallest alveoli, each component plays a vital role. Effective examination, targeted exercises, and comprehensive management strategies are essential for those with respiratory challenges. Remember, healthy breathing is the foundation of a healthy life. Thank you for joining us on this journey. Breathe easy and stay well.